Oh, do you want me to hit it and walk out?
No, you're good. All right, it's recording.
Come in. Hi.
Hi.
I'm Jennifer. I'm going to be your student nurse today.
Okay.
I'm going to be doing a physical assessment on you. Just going to close the curtain here for privacy. And are you in any pain today?
No.
Do you have any allergies?
No, I do not.
Okay. Can you state your name and date of birth for me, please?
Molly, November 1st, 1991.
Okay, Molly. We are going to start the general survey. Patient is in overall good health, doesn't appear to have any signs of illness, dressed appropriately for the weather, alert and oriented. And then we'll start the assessment, starting with the head, palpating for any tenderness or masses. None felt. And then I will go to the skin. Sorry, my hands are cold.
Okay.
Skin is warm in temperature, no excessive dryness or moisture. And then I will go to the eyes. We will test the pupils. Follow my pen. Hit the light, please. Okay. They constrict appropriately in accommodation.
Okay.
Pupils are reactive, equally round, reactive to light and accommodation. Conjunctiva is pink in color. And then can you smile for me and blow out your cheeks? All right. Tested cranial nerves 5 and 7. And then I will look in the mouth. And if you could just open up and say ah. Uvula is midline, tongue is smooth, tonsils are not present because of previous surgery. Teeth are all intact, no signs of cavities. Gums are pink in color, mucosa is moist, no lesions apparent. And then I will go down and I will test the carotids, palpate. And then I will listen to each. And when I touch you with this stethoscope, if you could just take a breath, blow it out, and then hold your breath for a second when I touch you. Okay, other side. All right, no signs of bruits. Then I will go down and assess the skin for skin turgor, which is good. No signs of dehydration. Go down the arms, no lesions. If there were, I'd do A, B, C, D, E. Then I will do the brachial pulses. Good. Radial. And then I will go down to the fingers, assess the capillary refill, which is good, less than 3 seconds. No signs of clubbing. And if you could just grab my hands. All right, skin grasps are good. And then I will come back up and I will assess the heart sounds, starting with the aortic in the second intercostal space, pulmonic, second intercostal space, herbs in the third, tricuspid would be fifth, and mitral would be fifth, mid-clavicular line. Then I will flip that over and I'll listen for the apical rate at the mitral valve for 1 minute. Then I will go back up to the tricuspid, herbs, pulmonic, aortic. And then every time I touch you with the stethoscope, if you could just take a deep breath, I'll assess the lungs now. And I'll check in 10 spots for that. 1, 2, 3, 4, 5, 6. And I would do 7 and 8. And if there were large breasts, I'd ask them to spread them apart. And then I will do 9 and 10. And then I'll move around to the back, assessing AP diameter, which is good, 1 to 2. And then if you could just lean forward for me real fast, I'll assess the spine, which is flat, no abnormal curvature. And then if you could just take another deep breath while I touch you with the stethoscope. 2, 3, 4, 5, 6, 7, 8, 9, 10. And I will test the costovertebral ankles for any tenderness.
No.
Did you feel anything?
No.
Okay. Any over there?
No.
All right, no tenderness apparent. And if you could just lay back for me, please. I will assess the abdomen. If you could just pull your shirt up a little there. I will start in the right lower quadrant. And I will auscultate each quadrant first, listening to the vowel sounds. Starting right lower, right upper, left upper, left lower. And then I will percuss. Any tenderness? Okay. Any over there? All right, and then I will palpate the right lower where the right ovary appendix would be, right upper where the liver and gallbladder, sorry my fingers are cold, left upper stomach, and the left lower sigmoid colon. And then I will just have you sit up, you can pull your shirt down, and I checked for jugular vein distension, which there was none apparent. And then I will continue going down into the legs, and I will check the popliteal pulses. Good. Posterior tibial. Good. And the dorsalis pedis. Good. And then I will do the Babinski test. Now just toes moved appropriately. And then if you can just stand up for me, I will now perform the Romberg test and close your eyes. Test it for 20 seconds, no swaying apparent. And then if you could just walk a little bit and then walk back. And gait is stable and steady. Yay. That's it.